Hi, I'm Alex. I'm from Innovacom. I'm product manager. I'm here to say to you that at Innovacom, we have been delivering a cutting-edge interoperability platform for over 20 years now, 100% dedicated to healthcare systems. Our main goal, our baseline actually, is saving time for care. What we want is to enable a more efficient use of data. And our expertise today spans across telemedicine, imaging, patient pathway or care coordination, but also data integration and obviously interoperability. So how do we manage it? We have a no-code solution that collects the data from any format and any protocol, and that send this data after transforming it to the expected format.
Good afternoon, everybody. I hope you had your coffee and that you're ready for a very exciting show here. Today, we'll walk you through a concrete real-world scenario that demonstrates the value of interoperable and connected care within a hospital. We'll follow Renee, a 75-year-old patient that has a heart problem. I will pass it over to Marco over here. You'll be able to follow the slides on the screen to my right. And as we go through the use case and you see all the vendors demonstrate their part, they'll be using the two other screens, my left and my right, and you'll be able to follow that way. Marco?
Thank you. Good afternoon. My name is Marco, and I'm pleased to present a complete acute care hospital workflow with a focus on purpose-driven interoperability, supporting the true continuity of care. Our story begins with Renee, a patient with a chronic condition who is regularly monitored at home through connected devices, for example, blood pressure measurements, and through routine consultations with her doctor. Suddenly, her condition worsens, so an exacerbation of symptoms triggers the dispatch of an ambulance. Pre-hospital data is collected and transmitted in advance, ensuring the hospital is prepared in her arrival. Due to the complexity of her condition, a surgical intervention is planned for the coming weeks. Renee is then admitted to the hospital and progresses through the perioperative phase of her care. Post-surgery, she receives inpatient treatment, including prescribed medications. At discharge, an International Patient Summary, or IPS, is generated. This includes her recent clinical history and a detailed care plan. Renee then returns home and resumes remote monitoring. Before we begin the demo, please note, for the purpose of this showcase and due to time constraints, we will emulate the EHR system activities to illustrate Renee's care journey. So let's start with Renee's electronic medical record. This is accessible thanks to a prior hospital admission related to her chronic condition. She has been identified and assigned to a cohort of patients with similar profiles. From this high-level dashboard, we can easily retrieve her demographic and historical health condition. As a part of her care plan, Renee is enrolled in a home-based remote patient monitoring program. And for this part of the workflow, I'll now hand over to Gnomon Informatics.
Hello, everyone. So, my name is Vakos. I'm presenting Gnomon Informatics. So, our main platform is named HIMSS25. As Renee, he is still at home. After she had diagnosed, he is enrolled to home-based enrolled patient monitoring with a care plan to follow. So, in HIMSS25, he can have all the care planned with daily activities to do, such as diet, exercise, some measurements from blood glucose away, some pills to take, drugs, whatever. All care plans follow with alert rule over here. And also can have measurements without devices, glucose meter, temperature, whatever it's needed, can in real time coming to HIMSS25 with daily recent activity to check to eHealth Pass in mobile app in Renee, in the patient web app as well. So everyone is notified about it and feels safe with it. So after that, I will pass to my colleague from Gravity Health, João.
Hello. So Renee has the Gravitate Health app in order to manage her medication. You see, Gravitate Health app takes the information about the patient to the International Patient Summary, gets the leaflet from the medication in a digital way, also in HIMSS25, and tries to personalize it in order to make it actually usable and supportive for the patient needs. In this case, Renee has two things. As most of us, she also has a lot of allergies and she takes medication for it. And with our lenses over here, you see that one of the interactions that it catches is that it gets data from third parties, in this case, the pollen count in her area, and says, please take care of it because there's a high pollen count in your area. Your allergies may start acting up. So this is one of the things that we can do. Try to use this information, fetch third parties information, and try to enhance the leaflets for the patient. But for this case, we have the Ramipril, which is for heart failure in this case. And we can do also integration with third parties. In this case, in specific, we can see why she's taking the information, in this case for heart failure, but also we can do a very interesting part, which is try to connect and do the pre-admission if something goes wrong. And so she starts having serious problems with her heart, in this case, rapid heart rate, unexplainable rapid heart rate, which is actually something that was already taken into account for given her condition. And so we can basically connect with third parties app, in this case, with the hospital in the neighborhood, and also call the ambulance in order to go fetch her up and try to send her to the hospital. And since the ambulance is on its way, I will pass on to my colleagues from Palo Alto to show you what happens inside the ambulance.
So now we're going to talk about specifically around 5G and around Prisma Access Browser, which kind of really speaks to how, as Renee gets moved from a home setting to a hospital, what does that journey look like? So it's really around looking at 5G connectivity where the traffic is encrypted. And as she's being moved from a home to an ambulance, making sure that all the information that needs to be available has been securely provided to the ambulance team and has been transmitted to the hospital. So there is no delay. And more importantly, it is securely protected from that standpoint. And this is very critical given the nature of how the transition is taking place and creating zero latency. Once Renee reaches hospital, this is where the secure access browser really comes into play. This is looking at how do you allow access to informations for authorized individuals, specifically making sure whether it is EHR applications, whether the nurse or the clinician is trying to access any particular information, he or she can do that in a secure manner. So what you see over here is around Prisma Access Browser, where information is available, but certain information is encrypted as by only authorized individual can get it. For example, if the individual tries to access information or download information which they're not authorized to do so, the Prisma Access Browser will block them or will restrict them from doing either one of those things. This is pretty important because patient safety, data security is of utmost importance. And via the Prisma Access Browser, this can be very securely managed in all the different applications that they have. And here's just another example. If there's an audit report that somebody's trying to create, this would be also available only to individuals who are authorized to access that information. The net of this workflow at the end of the day is making sure that data, patient data, is securely transmitted, is on time as Renee is moving from home to the hospital via the ambulance. And this could be a situation that may matter between life and death, making sure that the care providers have the information readily available by the time she arrives to the hospital. And here are some of the cost savings which we have seen to different use cases. And this is pretty important, making sure that combining the power of Prisma Access Browser with 5G SD-WAN, we can provide positive business outcomes for the organization. So at this point, I would like to hand the floor back to the Dulles team to take on to the next step in the use case. Thank you.
Once Renee arrives at the hospital, clinicians can review her entire clinical history, including data from her own monitoring and the ambulance service. With a full picture of her condition, the medical team decides the surgery is necessary. The planning of this procedure is supported by the Daedalus AI-based scheduling system. This tool automates the scheduling of interventions based on configurable rules, resource availability, time efficiency, and patient conditions. It also provides a complete set of KPIs, including operational, statistics, and planning insights. In our scenario, the intervention has now been scheduled for the coming days, and the day before her operation, Renee is admitted to hospital to begin the inpatient phase of her treatment. And for this part of the workflow, I now hand over to Enovacom.
Thank you, Marco. So I will continue with this step of the pathway of Renee in the hospital. So this is a really important step in where we will find a lot of exchanges of information, mainly demographics. It means name, last name, date of birth, and all that data from this patient Renee, and also all the scheduling data that will concern the intervention that she will follow. So for that, in the beginning, when she arrives to the hospital, she will be identified with a device like this one. So a barcode will be linked to the patient thanks to Zebra devices. And behind this system, there will be several data flows that will start to go out of this system. Inside for example, Daedalus, they will need this appointment information in the format that is called HL7 SIU. And also, BD Pixis cabinets will need information about demographics of Renee. And for that, Enovacom proposed this solution that is an integration engine where you will see that we are able to capture data whatever the format it is in the inbound service, and we will adapt it and send it to the several services that will need it. We see here that we are capturing it from Zebra systems, and we are sending it inside BD Pixis cabinet and also to the Daedalus Command Center. So like that, we are going to be able to be sure that everybody receives the same information, that the information is only typed once when Renee arrives to the hospital, and that we are using all interoperable standards. And then I will pass to Zebra that will continue with the pathway of Renee in the preoperative monitoring.
Hi everyone, my name is Jean-Nicolas and I'm representing Zebra Technology and I'm covering the French upscale market. So now we're going to talk about one of the technology that we are managing, which is the RFID. So we all know that losing surgical instrument trays, whether it's owned or rented, is both expensive. It can delay patient care. It can also lead to cancellation of operation. So thanks RFID, including assets, mobile devices, Zebra allows to quickly find, trace, and perform inventory counts. So how does it work? It's pretty easy. Once everything has been tagged, the staff can easily find the correct trace for Renee procedures by using an RFID scanner like this one. So you just have to pass, click, and when you hear the beep, meaning that you find the right asset for the right person, so for Renee. So once read, as I said, the track and trace solution has been done, and we can also add additional functionalities such as recall management.
Renee has now been admitted and correctly assigned to the surgery and inpatient cohort. She is now ready to undergo the procedure. To support the perioperative process, Daedalus Command Center provides a comprehensive dashboard, we can call it Metroline, offering a consolidated view of all scheduled surgeries for the day. Here, the decision maker can view a live operational summary. For example, there are 125 surgeries scheduled plus 14 emergency procedures. Of these, 69 are confirmed, 9 have been suspended, 24 patients are in preparation, 5 are in theater, no one is in recovery phase, and 42 procedures have been completed. These figures are updated in real time based on messages received from the various hospital systems. I'd like to highlight to your attention this section here, which identifies potential surgery blockers, for instance, patients with fever or latex allergies. This functionality is a powerful aid to hospital operations as it enables dynamic reallocation of surgical slots in coordination with the AI scheduler. Another valuable tool is the OR Kanban view. It offers the same information but with a greater detail, allowing teams to drill down into each individual case. Here, for example, we can see the exact timing of each step in Renee's surgical journey. Thankfully, the operation is a success, and Renee is now recovering in the inpatient ward, but she is in pain. And as a part of her treatment, she will require medications such as an anti-inflammatory and antibiotic. And for this segment of the workflow, I now pass over to BD.
Hello, bonjour. Guillaume from BD, Becton Dickinson. Now that the surgery had been done, the patient will receive an antibiotic and a painkiller. So the order had been sent to the PICSs. All the patient demographic had been done also. So come with me, and we will see what will happen on our system. So we'll just log directly to our PICSs cabinet. Thanks to my bio ID, I will just select my patient list linked to my ward. And thanks to the patient barcode, I will select the right patient. So I know that I'm working on this patient. I will be also able to see the patient demographic that had been sent through the interface part. And I will go directly to select the drugs that need to be delivered. I will prepare my 2 drugs, and I will take it. Automatically, the drawer is opening. You can see that these QBs have been opening automatically at the first point. I can take my drugs. I will close the first one. I will keep that for me. And then I will select the second one. When I will just close the second QBs, I will close the drawer, and automatically, thanks to the interoperability stuff, all the system will be allowed to know what happened on their stock. We send all the information to all the counterpart system in your organization. Now that has been done, I can continue to prepare my drugs. So here, I will go to my infusions topic. I just arrived in front of it. I will go to our Guardrail security preparation, IV preparation. I will select the drugs. Then I will select the strengths and the volume that need to be done, the volume that need to be infused on. I will then select the way to end the pump. I will click OK, and I will start the pump. When I will click on the start here, all the trigger will be sent automatically to your organization. Here, thanks to Innovacom, we are able to see the message that will be sent back. It's very important for us that all the trigger will be sent. The volume, the rate, the start, the stop, everything will be sent just to make sure that your system will be allowed to communicate and to store it. So now I will just go back to Daedalus. Thank you.
Renee is now feeling significantly better, and the team is preparing her discharge. The clinicians review her updated medical records, including the medications administered during her inpatient stay, and begins drafting the discharging letter. As mentioned earlier, we are using an EHR system emulator to trigger the events in this presentation. So now I'm triggering the discharging process. Now the patient is in the discharge status. Upon discharge, a crucial final step is the generation of the International Patient Summary, or IPS. This document captures Renee's full clinical journey, along with her ongoing care plan. At this stage, the Daedalus Command Center creates and transmits an HL7 message containing all the relevant discharge and care data and shares it with Nomon Informatics.
Hi again from Rome Informatics. So Renee, she's back home, can continue real-time monitoring as we previously with the devices, let's say glucose meter. So he can go to her eHealth Pass application, go into the specific section and find everything here. Let me find blood glucose. Here it is. So recent activity and all this data shared to the doctor he have check on here, so he can feel safe at home and continue to monitor himself. And I'm back to Marcos.
As mentioned at the outset, this showcase is about interoperability in action, the seamless movement of data between systems ensuring continuity of care throughout the patient journey. In this final view, we can trace the full list of exchanged messages across the various systems involved today, providing a clear vendor-neutral perspective, which also greatly supports the hospital IT department activity. In this scenario, the Daedalus Command Center does more than manage data exchange. It elevates interoperability by unlocking the true value of data across structural, semantic, and process layers. I'll now hand it back to the event organizer for the closing remarks. Thank you.
Thank you very much for illustrating Renee's path through this interconnected healthcare journey. I hope that this was able to help you better understand how these systems interact, connect together, and are able to exchange information using the standards. So this slide here kind of demonstrates the details that go on under the covers. Marco did a lot of showing you as well, a lot of these transactions. They're based around standards. And this is how these vendors were able to pull this together in such a short amount of time, and showing you that it's really possible to have all these different vendors interconnected to achieve a personal centralized care in an acute environment. So thank you very much for all your attention. I invite you to join our use case tomorrow and see the providers here at their kiosks. If you have more questions, please do not hesitate. Thank you all very much.
Our interoperability platform plays a crucial role into exchanging the data between care teams, between EHR, and this is mainly basically what we call meaningful interoperability. This is what we do. We want to enhance the care and the patient journey. Thank you.